Hi, Facebook family. I just thought I'd give you an update on my journey. I was going to wait until after I'd seen Mr. Peach this month, the gentleman in Leeds who did the procedure of the isolated limb infusion, but I thought I'd give you an update now because I have got a few updates. My scans for my breast cancer, no evidence of disease, which is absolutely awesome. I keep continuing to defy sort of what they did actually initially say to me in 2016, which was, you've only got 3 years to live. I'm still here. So, that's really good news. Now, the scan on my leg, good news and bad news. Part of it has died, and there's like cell death and necrosis. Now, what I forgot to ask him at the time was, because I'd had a scan done on May the 5th, then the procedure was done on July the 4th. I wanted to know if he'd done the comparison of the growth of the tumour, because he did say, that there is slight growth on it. However, if those of you that know anything at all about melanoma will know that melanoma is very, very aggressive, grows very, very quickly and at a rapid rate. So those sort of 8 weeks or so that I waited for the procedure, it will have grown an awful lot, and it had grown an awful lot. It was the size roughly of a cantaloupe melon. I could wrap my whole hand around it. I think it's shrunk because, I check it about every, I don't check it every day because it's no good checking it every day. It's about once a week. I'll just check to see what it's doing. It is doing something because it's a really weird sensation. It feels like, it's rebelling. It feels like a big rebellion's going on there in my thigh, and I can feel it moving every so often. It's a very strange feeling. I don't know how to explain it, but that's about the best I can do. So I've had the immunotherapist consultant rang me, and he was telling me all of this. So I did have a discussion with him in respect of, where do we go from here? And what he has said is we'll carry on with the immunotherapy treatment, and he wants to scan me again in a couple of months, and see where we're at with it then. When I see Mr. Peach, I think he's probably going to agree with all of that. Let's carry on with the immunotherapy, see what happens, wait for the next scan results, and just have a look to see where Charlie melanoma is and whether he's starting to vacate a little bit more from the premises where he is not wanted. He's had his eviction notice with a big dose of chemotherapy. And then we discussed, possibly the procedure may be done again to, give it that extra boost to, make it, really get out. And then carry on with the immunotherapy, wait for the results of, possibly another isolated limb infusion, see what happens then. If all of that doesn't work and it's still isolated in my leg, you know what I'm going to say, don't you? The next thing and the next consideration is that I possibly may lose my leg, but it's a whole lot better than losing my life. So that's where I'm at so far with all of treatments and procedures. Now, good news, I had a heart scan recently, and that is the functionality of my heart is slightly better than the last heart scan I had. So that is absolutely brilliant. I'm absolutely thrilled with that news. I've had treatment today, which I've had like a double dose of treatment today. I've had the immunotherapy, which is on the intravenous drip, and also the injection. The injection is the part that I have for the breast cancer treatment. All went well. I feel fine. The nurse hadn't seen me for a while. The last time she saw me was when I'd not long been out of hospital from having this isolated limb infusion done. And she did say to me, she says, I was really worried when I saw you last time, just because you look really poorly. And I've been looking back on some of the videos because I've actually uploaded them onto YouTube. It's just to try and get the word out there and get as many people as possible having a look at my journey. And because I want people to talk about cancer and not be afraid to talk about it. And I want people to ask me questions. So if you've, as always, as I always say, if you've got a question that you want to ask, or you think, oh, that's a bit invasive, that question, nothing will faze me whatsoever. So if you've got a question, please do ask. I want you to keep yourself safe and well out there. Keep washing your hands, as I keep saying on my show. And I do have a couple of things to look forward to. I'm going to the Sportsman's Dinner this month, so I'm really looking forward to that. I've got my dress, I've got my shoes. I'm actually wearing trainers, but they're really posh trainers. They're rather nice, let me tell you. So I've got my bag and everything. I'm getting my hair done by the wonderful Wendy Owens. She does my hair all the time. And I'm having an updo, so I'm going to look posh. Well, I'll try to look posh at the very least. And I'm also going to the ladies' night with the Friends of Southport group as well. So I am getting out and about a little bit more, albeit slow. I've still got to use a stick, and I can't go shopping anywhere unless somebody's with me, because if I go into a store, I do actually need to sit in a wheelchair and somebody push me around. Now the problem is when my grandson does it, he's sort of coming up 14, going on 40. He thinks he's a lot older than what he actually is. He likes to try and do Tokyo drifting, which doesn't bode well when you're sat in a wheelchair. But anyway, I'm okay. I'm doing all right. Everything's reasonably positive. I feel well, and I'm having a lot of fun with the radio show as well. Now, don't forget, if you want to come on the show and have a chat with me, please do get in touch, because I'd love to have people on the show. And just, we can talk about anything, doesn't matter. We can put the world to rights and just have a bit of a laugh. Take care out there, and I'll see you all soon.